everyone. I'm Lori Bloom, co-founder of Gracefully Graying. Welcome to Gracefully Graying Live. We are connecting you to information and resources in Michigan and beyond to help you create and maintain a productive and vibrant life as we are all gracefully graying. And as always, a thanks to our sponsors. Enjoy the live stream. Welcome, everyone, to Gracefully Graying Tuesday live stream. Today, we welcome Rodlescia Sneed, PhD, you've got a long title, social gerontologist, assistant professor at the Institute of Gerontology and Department of Psychology at Wayne State University in Detroit. So welcome, Rodlescia.
Thank you. Thank you so much for having me.
Yeah, your work is huge, and you do some really important work, I know. Today, we're going to be talking about health issues in our aging prison population. And I know that, your work aims to kind of close the gaps that contribute to inequities in health and well-being in urban or economically distressed communities. So tell us about your background, with public policy, with the issues surrounding that, and how this affects your work and your area of expertise.
Sure. So I'm a social gerontologist, and I'm interested in social factors that impact health outcomes for older people. A lot of the work that I do is focused on health equity. So helping people to get what they need to age successfully. I did my PhD actually in social and health psychology, looking at the interplay between social and psychological factors and how they impact health outcomes. I also have a background in public health as well.
Yeah, you're quite an accomplished person. So congratulations on all of that. So specifically talking about our prison population and the age group and the issues that come up with health related issues in the prison population.
Sure. So we know that actually the number of older people who have justice system involvement has increased significantly over the last couple decades. From 1999 to 2016, we saw that the number of adults age 55 plus in state and federal prisons increased by about 280%. And this is largely due to changes in laws related to incarceration and criminal justice reform that occurred in the 1980s and the 1990s. And so what we see now is that we have a generation of people who've had ongoing involvement with the justice system. They've been in and out of prison or jail, and now they're older people. We also see that as states started to create mandatory sentencing laws and started to reduce parole within their states, that we have a lot of people who may have been incarcerated in their 20s and 30s and are now aging in prison as older people.
Wow. And I would imagine that this is obviously nationwide. I mean, it doesn't really pertain to any specific area of the country, but it's probably going on all over the place. Is that correct?
Absolutely. All over the country, we see that prisons are incarcerating a larger number of older people compared to what we saw just a few decades ago.
So are these people being incarcerated, so you're saying at an older age, or they're just, incarcerated at a young age, but staying in prison longer?
So we sort of see a mixture. So we see two types of people. People who may have had justice system involvement starting when they were younger, when we saw changes in criminal justice laws, but they've continued to cycle in and out of prison. And so these same people who were in and out of prison when they were young are now older people going in and out of prison. And then the other thing that we see is people who got incarcerated when they were young, and now 30, 40, 50 years later, they're now older people in prison. So these are people who may have lifetime sentences and are older people in prison.
Okay, so your research is focused on this area, correct?
Correct.
General research?
Mm-hmm.
Can you explain that a little bit more in depth?
Sure. So we're interested in understanding what it means to be an older person in prison and how to best support older people who are incarcerated. Prisons weren't designed for older people. Prisons are designed for people who are able to get up and down out of a bunk, who are able to respond to orders from the staff quickly and easily, people who may not have a lot of health problems and may not need a lot of health care. But what we're actually seeing is just the opposite. There are a lot of people in prison who have chronic health conditions, and prisons weren't really designed to address those kinds of issues. So a lot of my work is really focused on how can we best address chronic disease within prisons such that the older people who are incarcerated can benefit.
So what kind of chronic conditions are you specifically talking about?
Yeah, so we see that more than 60% of people who are incarcerated have high blood pressure. We also see high rates of diabetes. We see high rates of heart disease and arthritis. So those are the most common ones we look at.
Yeah, and I would imagine that some of it, maybe a lot of it, has to do with stress and diet, and that exists within prison. Can you explain how maybe that could be a factor, or is that prevalent? Is that kind of a you know a basic? That's Well, go ahead. You
Yeah,
can explain it better.
Yeah, so if we think about chronic health conditions and think about risk factors for chronic health conditions, certainly stress plays a big role. Being in prison itself is a stressor. We can also think about things like physical activity and diet as well, and how they play a role in the development of some of these chronic health conditions. A person who's outside of the prison system, for example, when we talk about engaging in physical activity, they can go for a walk around their neighborhoods or go to gyms or engage in other types of exercise. But a person who's incarcerated doesn't have those same opportunities. So they may get an hour at most to be outside, but they're not walking around all day. They're sitting in a cell all day long. And so they're not getting that physical activity that they might get if they were in community settings. We also see that diet plays a role as well. We think about something like high blood pressure. It's important to eat fruits and vegetables and to eat a low sodium diet. And oftentimes, either that's not available in some settings, or people may not be aware that they need to have a special diet when they're dealing with a chronic health condition while in prison. We know that health literacy is very low. Your average incarcerated individual only has a fourth grade reading level. So, kind of thinking about health literacy and people actually understanding what it takes to manage a chronic disease can be difficult in prison.
Yeah. And so, with your research, are you in contact with the management of the prisons at all? Do you
Yeah.
interact
So,
with them?
Yeah, so the project that we're running right now, what we're interested in is looking at how we can implement a program called the Chronic Disease Self Management Program on a large scale within prison systems. This is a program that's implemented quite a bit in community settings. So you'll see it at your local area agencies on aging, you'll see it at the National Kidney Foundation. They also sponsor this program. And so we're interested in talking to people within the prisons about how to implement this program on a large scale within a prison system. So this includes talking to administrators, talking to the health professionals who might work in the prison, like the social workers or nurses or physicians, as well as the administration, to figure out what it takes to really implement a program like this on a large scale.
And are they open to discussing this? And do they receive this well? And are changes being made?
So we're in the process of collecting data right now. And these are prison systems that all have conducted this program to some extent, mostly on a pilot basis. So they may have done it in one facility within the prison system, but they haven't necessarily done it on a large scale such that it's implemented throughout the prison system. And so that's what we're talking to people about. What does it take to take this program that you may have been doing so far on a really small scale? What would it take for you to actually ramp things up such that you could implement it on a really large scale? So these are already prison systems that have made some decision that chronic disease management is important to them. such that they've already done these pilot programs. And so we're just asking them to tell us about that and how we can um, then develop a plan to scale it up on a large scale within a prison system.
And so are these regional prisons or federal prisons or both?
Yeah, so we're interested in state prisons
State.
primarily. Right.
Mhm.
And so you'll have a mixture of public and private prisons. In Michigan, for example, our prison systems are public, but there are private systems that have implemented this program as well.
Okay, so it's a mix. Would you say
Mhm.
like a 50-50 mix, public, private?
No, probably more like 75-25 public private. Yeah,
Mhm.
mostly public systems that we've been looking at.
Right, right. And then the other part of this is, are you interviewing prisoners? I mean, are you talking to a lot of people and you're getting feedback and collecting data?
Right. So we're just getting started, but our plan is to talk to a mixture of prison staff as well as incarcerated individuals themselves who may have participated in the program, either as just participants coming every week for the program or as individuals who actually led the program within the prison system. Some prison systems have opted to have incarcerated individuals trained as leaders who can then go on to teach the program to their peers. And so we're interested in talking to the incarcerated individuals, as well as prison staff, as well as people from external agencies who may have come into the prison in order to lead this program.
That's amazing. I mean, what good work you're doing. So important. So it's probably very apparent, but your final goals, your in your study, your goals, your hope for all of this. What do you think?
So ultimately, our goal with collecting the data that we're collecting is that we'll be able to develop a scalability plan that'll be a roadmap for a prison system that might want to actually implement this program on a large scale. So our goal is to get to the point that the program is offered within a prison system to anybody who needs it, regardless of what facility they may be in, regardless of their demographic characteristics, regardless of whether they're in a minimum or a maximum security prison. What we want is that anybody who has a chronic health condition who's able to consent to participate will be able to participate, and we'll have a roadmap to help prisons do that better.
Okay. Are you also working with the incarcerated, their families, or not so much?
Right now, no. The program itself is really centered on working with the incarcerated individuals themselves for
Mhm.
self management, but a part of the program is also giving incarcerated individuals the tools such that they can talk to both their healthcare providers and their families about their health conditions better. So, helping them to come up with action plans that they can share with their loved ones as well as their healthcare providers is a part of the program.
Right. And this is, for people that may not even have chronic health conditions, but, to stave them off. I mean, just, how to stay healthier in prison, correct?
Yeah, so we're focused on people who have chronic health conditions, but a lot of the principles of the program are relevant for prevention as well, in terms of thinking about how to eat a healthy diet, how to engage in good exercise, how to talk to your healthcare provider in general. Certainly, those principles apply even if you don't have a chronic health condition.
Right. Which holds true for anybody, anybody,
Absolutely.
no matter where you are.
Absolutely.
Yeah, that's kind of the roadmap for healthy life for anybody. So when you're not working on this, what else are you doing?
Oh, lots of things. So, in addition to doing work within the prison system, I'm really interested in older adults who have justice system involvement of any kind. So, a lot of the work that I do also is focused on looking at older adults who have left the prison system and are now going back into community settings and understanding what resources they have available to them, the types of stressors that they may have, and how we can improve upon that. We know that 95% of people who are incarcerated eventually do go back to community settings, and they really face a lot of challenges, especially when they're older people.
Yeah, I can imagine. So you're continuing your good work after that, and you follow people, you maintain relationships with them, or how does that work?
So I partner with a lot of community-based reentry programs. So
Mhm.
these are programs that are designed for people when they immediately get out of prison. So the programs will find out that a person's getting out of prison and connect with them right away to help them get what they need so that they can successfully go back out into community. But a lot of these programs focus on employment or mental health or substance abuse and don't necessarily focus on physical health. And
Mhm.
so that's a lot of what we're doing in the partnerships with the reentry programs is introducing physical health programming within these reentry programs such that the older people who are getting out of prison also get the physical health information that they need along with the information that they might need about employment or housing.
Right. That's amazing. Wow. All right. So, how can people get a hold of you?
So I am a professor at Wayne State University. I'm always available by email. Um, Certainly, people can reach out to me at any time. I also have a pretty strong internet presence as well.
Mhm.
So if you Google my name, you can find all types of information about me as well.
Great. Yeah. I mean, and I have done that, and there was a lot of information on you. Trust me. So, thank you so much. I feel like we could keep talking. There's so much to talk about, and such an important work that you're doing, and an important subject. So, we really thank you for joining us on Gracefully Graying.
Thank you so much for having me. It's been great chatting with you.
Yeah, and then we'll do it again and learn even more. So keep up your amazing work. It's great. And we thank you to all of our sponsors and to our viewers. Find us on gracefullygraying.com and on all of our social media platforms. So thanks again and see you soon.
Thank you.